All right, if you have a dating app on your phone, listen up. Dr. Robert Huizenga, I'm sure you've seen him on TV. He's worked with celebrities, athletes, TV dieters. Here to talk about something different today, relationships, and he's got a new book out. It's called Sex, Lies, and STDs. Used to be sex, lies, and videotape, and now we've progressed or regressed to STDs, Doc.
Correct. It's a big problem in this country. You know, you have 160 million Americans with an STD, 25 million each year get an STD. So it's something that we all need to know about.
And in case you're not familiar with the acronym, we're talking about sexually transmitted diseases here. So in your book, you talk about the age of the swipe right culture. How have dating apps affected modern dating?
Well, there have been a lot more casual sex, some anonymous sex. It makes it difficult when an STD is identified to track the people who have it. And if you don't tell the people who you've had relations with that they have an STD, you know, then STDs typically have no symptoms. They go untreated, and the problem intensifies.
Yeah, that's not a conversation a lot of people want to have.
There's so much stigma, and there need not be. STDs are not scary. We've got really great prevention, we've got great diagnosis, and we've got great treatment, but you have to know about it and you have to get checked regularly.
Yeah. What's the most important thing that you want people to know?
Well, the most important thing is that we have great prevention and great treatment, but STDs don't have symptoms, and you got to get regularly checked. And if you're having regular intercourse, if you have multiple partners, you must understand these issues.
Okay. You say that Charlie Sheen inspired you to write this book. There's about a dozen punchlines that immediately come to mind here, but I'm just going to try to play it straight here for the moment.
Well, as you're aware, Charlie came out in 2015 and said he had HIV, and he and I appeared on the Today Show, and in that interview he said that he had had intercourse with several of his girlfriends without a condom. That initiated a firestorm.
Right.
And I thought, and they were criticizing me as well as an enabler doctor, people were not aware that a treated HIV patient is non-communicable, and they don't realize PrEP is out there, which we gave to girlfriends, that the chance that he would give it to a girlfriend with condomless sex was less than the chance a woman could get it if she went into a nightclub and had intercourse with someone with a condom. This is a whole new world. This is a new world. We have great treatment for HIV, and people can't have the stigma of HIV as some killer disease anymore.
But let me just make it clear here, because I want to make sure that I'm hearing this correctly. You're not advocating condomless sex for somebody that has HIV, right?
If someone with HIV is fully treated and appropriately treated, and their partner is treated with a new drug called PrEP, they are much, much safer than having intercourse with a condom. Yes, this is a new world.
All right.
HIV, there is a prevention that now makes it absolutely safe to have intercourse condomlessly.
All right, that's fascinating. We could do a whole show based on that. But you mentioned you really feel like everybody needs the information in this book. What's the most important thing, aside from having the conversation with your partner?
Stop the stigmas. Just like if you're an athlete, you're going to get a sprain and a strain. If you're sexually active and it's a normal, healthy function, you're going to get STDs. So let's recognize it and stop with all the BS of the stigmas, because it's needless.
Yeah, it obviously is something that needs to be talked about, especially with all the dating apps and people hooking up. Sex, Lies, and STDs, that's the book. Dr. Robert Huizenga, thanks for coming in. Appreciate
Thank you very
time.
much for having me.
All right, thank you, Doc.